Welcome to the eRecord. The eRecord is an online behavioral EMR. It is a full-featured, comprehensive electronic medical record for psychiatry and behavioral health, and it includes clinical record keeping, practice management, patient accounting, electronic claim submission, scheduling, e-prescribing, reports, decision support alerts and monitors, and much more. The eRecord is designed to be paperless. There's a patient login, a parent-spouse collateral login, and a staff login. Patients can log in, they can set up their own accounts, they can fill out forms, HIPAA consent forms, clinical forms, they can pay online. And even if clients don't fill out forms online, if they fill out forms on paper in the office, those paper forms can be scanned to the eRecord. What this means is that you can say goodbye to charts and you can run a completely paperless clinical office. Okay, now I'm going to log in. So I use the staff login and I put in my user ID and password. And I hit login. And this brings me to the home page. On the home page are a list of your current patients, their medical record numbers, address, telephone number, and you'll see on the left-hand side there are these yellow alerts, yellow triangles with exclamation points, which are alerts, and they are reminders of tasks that a clinician needs to do. Alerts can be for authorizations. Oftentimes clinicians will want to be reminded when they are running out of a managed care authorization, but they can be for anything. Okay, I'm going to go ahead and I'm going to click on a patient, John Zogby. This brings me to a patient detail page. On the patient detail page is really where I do all my clinical documentation. And I'm going to do a progress note for this particular patient. We have a library of clinical documents in our system, and we have templates for psychiatrists, psychologists, social workers, you name it. You can use our templates, you can edit our templates, or you can create templates de novo. Okay. I have clicked on a feature which pre-populates the prior note to today's note. That way I only have to edit a note, I don't have to write a new note. So you'll see that at the top, populated forward, is the diagnoses that I made at intake. And let's say I've decided that the bipolar is now a secondary. If I want to add a new diagnosis, I simply click on Add New Diagnosis. I get a pop-up window. I get a list of all the diagnoses, and I can click on a diagnosis that quickly and add it to the record. Now you see the diagnosis of schizophrenia has been added to the clinical record. In our system, to get paid, the clinician has to do one thing. They have to add a billing service code. So I'm going to add a billing service code of 90806. I hit save. It makes a round trip to the database, and you will see it loads that individual therapy 45-minute 90806 appointment to the database. Now I finished the progress note by checking the clinical information I had entered previously. If I agree with that, I simply sign it at the bottom with my password. And hit finish, sign, and complete document. And that's it. I'm done. Now I'm going to hit the back button. This brings me back to the patient detail page, and I'm going to go up above the header where the patient information is listed. You'll see that on 11/27 a clinician progress note was completed by me. Again, I'm going up to billing, and I'm going to see that on 11/27 a 90806 for $120 has been entered into the patient account. And I'm going to click here and I'm going to look at a receipt. And this is a receipt for this patient and really is the equivalent of a super bill. This happens contemporaneously in real time, so that anytime a clinician does a progress note or an intake, a patient charge is created. If the patient also has insurance, a claim is created in X12 format. For those of you who write prescriptions, writing prescriptions is very simple using the ePrescriber. You simply use a note that has the ePrescriber on it, and you, in addition to the clinical documentation, you'll add a medication. Adding a medication is very simple. You get a pop-up window. You can put in a medication. I'll put in a Abilify, and you'll get all of the formulations of Abilify. You can click on one. In a few keystrokes, you can write a prescription. As I said before, there are a great many templates in our system that you can choose from. CarePass deals with about 40 or 50 different academic institutions, departments of psychiatry, and so forth. And we have a tremendous number of clinical templates. Our treatment planning module is CARF approved and JACO approved. It's very easy to use, and it allows you to write a treatment plan in a matter of minutes. Now let us assume it's the end of the day and we want to send out our claims. We simply go to Practice Management, and we go to Claims and Encounters Administrator, and we want to prepare electronic professional claims. We can also create inpatient claims and EAP claims and all kinds of other claims. We put in some date parameters. Most people will send out claims every day because the turnaround time is much quicker in an electronic system. I'm going to ID potential claims here. I'm not going to find any claims because I don't have any claims that are ready to go out. However, if I have claims that are nearly complete but have missing data, I will be alerted to that. So our system makes sure that claims are clean before they go out. Again, sending out claims in our system takes a matter of moments and can be done in a couple of minutes at the end of the day. Okay, let's go over to the scheduler. And here is the scheduler. You'll notice if I put the cursor over the scheduled patient, their telephone number shows up, as well as the amount they owe and the copay if they have a copay. And to add a new patient, you just click on the time. You put in the length of time. If you don't have a default length of time, you could put in the type of appointment, and you put in a couple of letters, and you can find a patient, and you could add the patient. So John Public has been added to my schedule. If I click here, I get a formatted version of the scheduler, formatted for printing, and you can see that it lists the appointments, the name of the patient, the balance, the copay, their telephone number, and so on. In the next several months, we will be adding some other new features to the scheduler, including automated reminders via email and texting to the patient before the next appointment, as well as the ability for online scheduling by the patient. There are a great many other features of the eRecord. There is, for instance, an extensive reporting system that includes accounting reports, which are very extensive, hundreds of accounting reports, also assessment reports, census reports, utilization reports. One other feature of the eRecord that is, I think, distinctive is the fact that it has a very extensive outcomes and assessment system. We have 30 or 40 different outcomes instruments that you can use, and these outcomes instruments can be programmed to remind patients to take them for follow-up. That is a very brief overview of the eRecord. Thank you for taking the time to listen to this presentation.